is in the grip of a worsening drought with failed rains, collapsing crops, and rising food and water insecurity pushing millions on the brink. Over 4.6 million people are now acutely food insecure, and the Red Crescent movement has launched a 25 million Swiss franc emergency appeal to aid the Somali Red Crescent Society in scaling up life-saving interventions. With us now from Addis Ababa is Abdilahi Elmi Ali, who's Disaster Risk Management Director at the Somali Red Crescent Society. Abdilahi, thank you very much for joining us and welcome to the program.
Thank you very much, Vita. Pleasure to have you here.
Thank you so much for giving us an opportunity to interrogate this story, which sounds pretty critical at this stage. Tell us what you're seeing on the ground in Somalia right now in terms of water, livestock, households, displacement, and how does this compare with previous droughts?
Thank you very much, Peter. As you already know, there is a very severe drought in the country, and people actually are suffering a lot of high food insecurity, water shortage, and currently the country is facing prolonged actually droughts, especially compounded by severe and also extremely due to the funding cuts. And actually, we are dealing with a disaster-prone country where people are actually having a protracted crisis, especially the prolonged droughts. And due to the funding cuts, people actually have facing a very severe food insecurity, water shortage, and also actually some of the disease outbreaks. And this also escalates the current humanitarian situation in the country.
So your appeal for 25 million Swiss francs is a major push. Can you talk us through how these funds will be used? What kind of assistance will it bring?
Actually, the appeal recently has been actually launched together with IFRC support, and it is about 25 million because people are emergency and over 2.5 million were actually highly impacted by droughts. And we are targeting 450,000, which is most affected people out of this. And
What
in
type?
this response, in this response, we will be focusing more integrated and multi-sectoral approach, especially focusing integrated food security and livelihood support through cash assistance and wash, health, and nutrition, as well as also environmental sustainability and cross-cutting issues, especially the community engagement and also protection, gender inclusion aspects.
We're seeing several reports indicating that agencies like the World Food Programme are being forced to slash food assistance. For instance, cutting from 1.1 million people served down to something like 350,000 due to funding shortfalls. How are you managing or preparing for this kind of constraint and cutbacks?
Actually, the biggest challenge nowadays is the impact of the kind of funding cuts, especially the USAID funding cut and also other countries, because all the humanitarian actors already bullied out from the field. Either they reduce their staff, release their staff, or also close their offices. But as SRCS, we are community-based volunteer organization. We remain with the community, and this also increased burden to the national society because we are with the community. And every day people are coming to our branches asking us, what do you have for us? And also this actually increases the need versus the limited resource because the humanitarian actors, they don't have actually initially good representation because the national society, as Esther says, we have a good representation at all levels from village, district, and regional and national. But other organizations, when they close their offices, we remain with them, and then the disasters are increased, the needs are increased versus also limited resource. So the current biggest challenge now is the impact of the funding cut, and we are actually struggling to manage. But if we get the emergency appeal fund, might be it will also at least do something on that.
Funding and resources, the major issue and one of the problems. But I guess you have other challenges as well, and that's logistical, trying to get to people in remote areas, and maybe even security, because Somalia continues to be unsafe in parts of the country.
Actually, we are working all the countries, especially also the Somaliland side. And you are right, we are working in a fragile and context actually setting. And the currently people are also actually moving from one place to another to seek better actually life, especially seeking water and also pasture for their animals. And the current drought also impacted the livestock. There was a livestock death, disease outbreaks both human and also animals. And people are also migrating from actually urban to the rural, attaching to the nearest actually towns so that they can get actually assisted. So there is a population movement also impacted by drought, and also the scarcity of water is very high because the water is depleted, and people are also actually suffering a lot on that. But still, we in response to this, SRCs has also activated their anticipatory actions, especially early action protocol for drought from DREF, Disaster Emergency Response Fund from IFRC, where we have also done as a life-saving thing, but it was a small period of time, but the magnitude of the drought is bigger, and we are really appealing on that under the emergency appeal. But the whole country from Somalia, Somaliland, also is actually affecting highly by the people due to the funding cut and also the shortage of water, health. Even some of the organizations, during when we are doing the assessment in the country, we have engaged other humanitarian actors working there, and we realize most of the health facilities were closed by the humanitarian actors when they pull it out. And there is also high actually health facility need in terms of stock, medical supply shortage, and also actually the people, the staff in the health facility are not even actually paid. And it's difficult also to continue because the number is very huge. So those are the challenges around due to the impact of cutting fund.
Abdilahi, we're going to have to leave it there, but thanks very much indeed for talking to us about this pressing issue, and let's hope that this badly needed aid comes forward. Thank you so much for your time.
Thank you very much. Thank you very much, Peter, and thank you very much for your time. Actually, as a SRCS, we are working in like one national society in two countries. So I'm based in Hargeisa, Somaliland, as a DRM director. But Somali Red Crescent Society is also working all over the world, so all over the country. That's why I'm here to
Mm.
actually give you the interview. And thank you very much for your time. Highly appreciate it.
It is a pleasure for us. Thank you. That was Abdilahi Elmi Ali, who's the Disaster Risk Management Director at the Somali Red Crescent Society, speaking to us about this pressing issue, the drought in Somalia affecting 4.6 million people now, food insecure as a result.
From Cape to Cairo,